What's up? What's up? What's up, everybody? Hey, you guys know what we're doing today. We are doing NCLEX questions today. NCLEX questions today. Hey, I appreciate everybody being here. Hey, you guys know what the deal is. I want to know who you are, where you're from, where you're at in your nursing journey. Also, I am feeling a little under the weather today. Yeah, we're just going to be doing NCLEX questions today. We won't do any Q&A or anything like that afterwards just because. So, hey, but shout out to everybody that's just now joining. We're doing NCLEX questions. I need for y'all to smash that like button. I need for y'all to share. I need for y'all to follow. Those are the things that we need. If I don't have 100 people up in here and if I don't have 1,000 likes, we're not going nowhere. There's nothing new about what I'm telling y'all. It's not like it's new. So I want to know who you are, where you're from, and where you're at in your nursing journey. Let me know who you are. Let me know who you are. Hey, how you doing? What's up? What's up? Shout out. I see Bonnie. Is it Pris? I see a bunch of people jumping up in here. Hey, make sure you guys like the stream. You guys share. You guys follow. I need 1,000 likes, and I need 100 people up in here. I got a good amount of questions for y'all today on this Monday. A good amount of questions for y'all today on this Monday. So make sure you guys like. Make sure you guys share. Make sure you guys follow. Hey, did I have anybody take NCLEX? We got people graduating. Let us know down in the chat. All right, let us know down in the chat if you graduated, if you taken NCLEX, did you pass NCLEX? If you failed NCLEX, this is a safe place for you to tell us that. It's okay if you did not do well on that exam, all right? Because guess what? This exam is not the end all be all. Circle back and tackle it again, all right? Kiki09 says I graduate Friday. Shout out to you, Miss Ma'am, Miss Lady. Hey, if you guys are just now joining, we are doing NCLEX questions. I need 1,000 likes and I need 100 people up in here. Oh, obviously, y'all don't want no questions today. And I need for y'all to share. Like, follow. I'm Victoria. I already passed my NCLEX, but I still enjoy your classes. Victoria, I love having you here. Congratulations to you passing your exam. No, hey, I appreciate you being here because you want to give back. And that's what it's all about, giving back to everybody. All right. So what are we thinking? Man, I guess y'all don't want no questions today. Wow. Really? Amos? Famous Amos? Really? All right, I got something for you. Today. Hey, what's up? Shout out to all 45 of y'all up in here. We're doing NCLEX questions. Hey, I need for y'all to smash that like button. I need for y'all to share, and I need for y'all to follow. That is the trifecta that TikTok wants. I need 1,000 likes, and I need 100 people up in here. All right, well, 101. You know, that's what I need. What's up, Carolina? How are you? Welcome. It's been a minute since you've been here. So, hey, you already know. Hey, like I said, I want to know who you are, where you're from, where you're at in your nursing journey, except for Amos, because don't nobody care about her. Oh, my goodness. What are we doing? Hey, we're almost there. We're at 600 likes, 600 plus. Now we're at 700 plus. Cool. We got 80 people up in here. Y'all, here you go. Listen, man, I haven't even started yet. Kiki says, hey, thank you. Thank you for this. I'm in PN school. Shout out to you, Kiki, being in PN school, doing your thing. I'm glad that you find this helpful. Like I said, make sure you guys smash that like button. Make sure you guys share, you guys follow. As well as, I don't care what y'all got going on in school. Share it to somebody. I don't care how you feel about them. Maybe they could be friends with me. Maybe. You see what I'm saying? Hey, we're at 73 followers. What are we doing? Y'all got to push it out. Y'all got to push this out. Carolina says, I'm a new grad nurse. Shout out to you, new grad nurse Carolina. All right, well, y'all got me to 1,500 likes. I'm cool with that. You know, I guess everybody wants to be greedy and not come up in here. But here we go. Question number 1. What is the primary reason for administering morphine to a client with myocardial infarction? Is it A, to sedate the client, to decrease the client's pain, to decrease the client's anxiety, or to decrease oxygen demand on the client's heart? What are we thinking? We got D, we got B. Hey, if you guys are just now joining, we are doing NCLEX questions. Hey, by the way, I got these questions off of nurseslabs.com. However you feel about them, I don't care. They are free sets of questions. You guys can go over there. You guys can check those out for yourself, all right? And also, I want to know who you are, where you're from, and where you're at in your nursing journey. Where are you? We've got a bunch of people streaming C, or a bunch of people saying D. I'm sorry. Here we go. D. What else? What else we got? Got D. Okay. The beginning. The beginning of what? Lotus Cloud. What are we talking about? It says Jocelyn just says, I just passed my NCLEX. Thank you for the live reviews. Shout out to you, Jocelyn. Congratulations. I'm going to pin your comment right now. Shout out to Jocelyn, y'all. Right now, while y'all are answering, y'all, I want y'all to give Jocelyn all the love and all the support. Congratulations, ma'am. Welcome to the greatest shit show on earth, known as being a nurse. If there is a piece of advice that you could give, ma'am, what would that be? And once again, congratulations to you. And I'm so glad that you find whatever material, the lives that I have and stuff like that, that helpful. Just make sure you let other people know. That's how we're able to get bigger as a community, right? Hannah says, I take my NCLEX June 3rd. Shout out to you, Hannah. Oh, the beginning of your journey. Got it. Tracking. I'm picking up. But the correct answer is, it says learn testing strategies is just as important as learning content. Absolutely, because you need to know what they're asking. But the answer is D, to decrease oxygen demand on the client's heart. Morphine is administered because it decreases myocardial oxygen demand. Morphine to relieve pain during a myocardial infarction has been used since the early 1900s. In 2005, an observable blah, 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 blah. Morphine is a potent opioid, all right? It decreases pain, which in turn leads to a decrease in the activation of the autonomic nervous system, all right? These are desirable effects when a patient is it's having a myocardial infarction, okay? This is, stop it. Miss G's in the building, y'all. I can't stand her. But anyways, pharmacological and parenteral therapies, that is the second largest section on the NCLEX exam at 13 to 19%. LPNs, you need to know the same content. You need to know the same exact content that RNs need to know, okay? So this is very helpful for you, and you guys can go over there and get those questions as well, all right? Here we go. Question number 2, which of the following conditions is most commonly responsible for a myocardial infarction? Is it an aneurysm, heart failure, coronary artery thrombosis, or renal failure? Hannah's telling me C. Kiki's telling me B. Is it Paya or Paya? Paya? I'm sorry. It says C. No one cares what Amos wants. Lotus Cloud is telling me C. Is it Panchi? Is telling me C. Trio Mommy's telling me C. City Girls telling me C. All right. Shout out to all 35 of y'all. Hey, we're on the road to 10,000 likes, y'all. Keep smashing that like button. All right. Keep smashing that like button. Make sure you guys keep sharing and you guys keep following. Remember, that's the trifecta to get it out to those on TikTok that need it. All right. But here we go. Here we go. By the way, if we get to question 10, if I don't have 10,000 likes, I guess y'all are only getting 10 questions today. So there's that. Here we go. Here's our answer. Here is our answer in 3, 2. Is it Quila or Keela? Thank you for the follow. Appreciate you. Oops, I lied. And the answer is C. The answer is C, coronary artery thrombosis, right? It causes occlusion of the arteries leading to a myocardial infarction. Myocardial infarction occurs when the coronary arteries is so severely blocked that there is a significant reduction or break in the blood supply, causing damage or death to a portion of the myocardium, all right? That's physiological adaptation. Physiological adaptation, which is the third largest section on the NCLEX exam at 11 to 17%. All right, 11 to 17%. All right, LPNs, you guys know and have to learn the same content that RNs have to know. The biggest difference is that you need to know the scope of practice, what you can and can't do, what you can and cannot accept. That is the difference that separates the NCLEX PN versus the NCLEX RN, okay? Here we go. Question number 3. What supplemental medication is most frequently ordered in conjunction with furosemide, all right? So what medication, so the key word here is in conjunction, meaning given with. So if I'm going to give furosemide, I'm also going to give this specific medication, right? And then you have to understand, why is that medication given with furosemide? What does furosemide do that requires me to give that medication along with it? Is it chloride, digoxin, potassium, or sodium? Quant is telling me potassium, so it's C. Got you. All right. Hey, shout out to all 35 of y'all. We are doing NCLEX questions. We got them off nurseslabs.com. Hey, I want to know who you are, where you're from, and where you're at in your nursing journey. Furosemide is a loop diuretic and potassium wasting. Oh, that was Amos that said that? Oh, all I heard was bzzz. Okay, Kiki tells me Lasix lowers potassium levels. Okay, cool. Bree is saying K wasting. Okay. These are the thought actions that you have to do. All right. This is what NCLEX wants. Critical thinking. Critical thinking in order for you to make a clinical judgment. And yes, the correct answer. My bad, Amos. famous Amos. But the correct answer is potassium. Supplemental potassium is given with furosemide because of the potassium loss that occurs as a result of this diuretic. Loop diuretics act at the ascending loop of Henle in the kidney and help the body push out extra fluid that could accumulate in the lungs or legs and ankles when the heart is unable to completely pump blood throughout the body. But they may also cause the body to eliminate excessive amounts of potassium, which might be expected to increase mortality from heart arrhythmias. As a precaution, therefore, many doctors prescribe potassium supplements to their patients receiving loop diuretics. Pharmacological and parenteral therapy, second largest section on the NCLEX at 13 to 19%. All right. So shout out to y'all for getting that right. Amos, whatever. Congratulations to you as well, I guess. All right, here we go. Here we go. Question number 4. After myocardial infarction, serum glucose levels and free fatty acids are both increased. All right. What type of physiological changes are these? Is it electrophysiological, hematological, mechanical, or metabolic? What do we think the answer is? Hannah's telling me D. Okay. I got 2 keys in here. Okay. All right. Of course, Amos wants to put a lowercase d because she wants to be different. Natalie's telling me D. Natalie, hey, tell me D, but don't put a question mark. Just, hey, make your decision and run with it, all right? Because guess what? We're going to find twins. Hey, make a decision and run with it because guess what? We're going to find out what the right or wrong answer is, and you're going to find out why it's the right or wrong answer anyway. So usually wherever your gut instinct tells you, that's usually what the right answer is, okay? But let's see what the answer is, all right? Here we go. In 3, 2, and the answer indeed is D. See, look at you. Natalie, you got it right. All right. Both glucose and fatty acids are metabolites whose levels increase after myocardial infarction. Acute myocardial infarction invokes a characteristic neurohumoral response. Catecholamine release is increased. Plasma contents of fatty or free fatty acids and glucose are elevated, and glucose tolerance is diminished. That's part of physiological adaptation. Physiological adaptation, which is the 3rd largest section on the NCLEX exam. All right, the 3rd largest section on the NCLEX exam at 11 to 17%. All right, we're almost at 7K. That's what I like to see. Hey, get carpal tunnel for me right now. Amos, like when your fingers hurt, pull your toes out and start tapping on it, all right? Don't make that weird. Here we go. All right, here we go. Question number 5. Which of the following complications is indicated by a 3rd heart sound or an S3? All right, is it ventricular dilation, systemic hypertension, aortic valve malfunction, or increased atrial contractions? What do we think it is? It says I can't play. I'm busy tapping. Oh, okay. Well, you better tap and play. All right. The sexy beauty is telling me C. Hannah's telling me D. Princess Aaliyah. That's my niece's name. Shout out to you, Aaliyah. C. The Kikis are telling me C. I'm just going to say y'all, the Kikis. Twins. Quanten's telling me C. Hey, make a decision and run with it, Quant, because guess what? If you're going to tell me C, you're going to find out what the right answer is anyway, all right? All right. Hey, if you guys are just now joining, welcome. We're doing NCLEX questions. Make sure you guys smash that like button. You guys share. Hey, y'all got to get these shares up. Hey, share it to Becky with the good hair that you're in class with that you don't like. You know, be petty. Maybe she didn't graduate. Maybe you did. Now this is a good time to be petty. Show her something. You know what I'm saying? Here we go. Here's our answer in 3, 2. And the answer is A. It's ventricular dilation. Ventricular dilation. Rapid refilling of the ventricles cause vasodilation that is auscultated as S3. All right. The 3rd heart sound is a low frequency, brief vibration occurring in early diastole at the end of the rapid diastolic filling period of the left or right ventricle. All right. Physiological adaptation, which is the 3rd largest section on the NCLEX exam. Physiological adaptation talks about the pathophysiologies, right? Disease processes and how they affect the body. They talk about chronic injuries, acute injuries, medical emergencies. Physiological adaptation is huge. It's the 3rd largest section, but they could be subtopic in any one of the other sections. All right. So remember, 3rd largest section. All right. And if it's something that you don't understand, circle back and get your learn on with that. All right. All right, here we go. Hey, real quick, ladies and gentlemen, if you guys are new here, I have some test taking strategies that you guys can check out. Hey, it's 42 pages. It was one of my ebooks, and I was like, you know what? I'm just going to give this ebook away for free. It's 42 pages. You get it completely free. Who don't like free? Just saying. That's at thebootnurse.com/test. I mean, maybe Amos wants to pay me money, but I don't want her money. I feel like it's dirty, and I don't know where it comes from. You know what I'm saying? Anyways, go get you some free test taking tips to conquer the NCLEX. It's right around the corner for most of y'all. So go ahead and get y'all's learn on, and y'all go check that out. thebootnurse.com/test, or you guys can check the link out in my bio. All right, here we go. Question number 6. After an anterior wall myocardial infarction, which of the following problems is indicated by auscultation of crackles in the lungs? My money filthy, and you'll take it. Quit playing. Stop it. You're right, I will. Answer choice A, left-sided heart failure. B, pulmonic valve malfunction. C, right-sided heart failure. Or D, tricuspid valve malfunction. What do we think it is? All right, we got C. All right, now let's think about this. We're talking about a myocardial infarction. All right, but it says, which of the following problems is indicated by auscultation of crackles in the lungs? Crackles in the lungs. Which one of the disease processes in our answer choices talks about having crackles in the lungs? Crackles in the lungs tells me what? There's fluid in there, right? There's fluid in our lungs. Lungs equals what? Lungs equal what? Shout out to all 38 of y'all. Hey, a little bit about me. I've been a nurse it'll be 4 years next month. I was in the Navy for 16 years. I've worked ICU, OR, and PACU as a nurse. And that's why I'm here. I'm here with y'all, trying to get y'all's learn on. All right. My way of giving back to people that gave to me. It's the only right way to be. Trust and believe me. All right. So I appreciate everybody being here. Make sure you guys like, share, and follow, and tell me who are you, where you're from, and where you're at on your nursing journey. And the answer is left-sided heart failure. All right, left-sided heart failure. Hannah says left is lung. You are correct. That's a really good way to remember it. L for left, L for lung. Shout out to you. All right, the left ventricle is responsible for the most cardiac output. All right, an anterior wall myocardial infarction may result in a decrease in left ventricular function when the left ventricle doesn't function properly, resulting in left-sided heart failure, fluid accumulation in the interstitial and alveolar spaces in the lungs, and causes crackles. That's part of physiological adaptation, which is the third largest section on the NCLEX exam at 11 to 17%. Yeah, you guys are going to hear me say this all the time. I will tell you where it falls, and I will tell you what the percentage is. It's the third largest section, LPNs. Same for you when you take your NCLEX, all right? It's all about the scope of practice, but you learn the same content, all right? So if you understand that, cool. If you don't, circle back and get the content. I'd rather you get it wrong here than go on NCLEX and get it wrong there. Is it Shania? Hi, Shania. I just graduated from nursing school, RN, and I'm waiting to take my board. Shout out to you, Shania. Hey, go out there, go forth and conquer, right? You're going to do excellent. I'm glad that you're here. And you're going to be ready for that NCLEX when the time comes. Here we go. Question number 7, which of the following diagnostic tools is most commonly used to determine the location of myocardial damage? Is it a cardiac ablation, cardiac enzymes, echocardiogram, or an electrocardiogram? Everybody's screaming D at me. They're like, D. All right, here we go. B, troponin. Where do you see troponin at? I mean, I know what you're talking about. I know what you're talking about. A man's telling me B, and this was on my NCLEX last week. Look at that. Look, hey, listen. And I hear people come up to me and tell me all the time that these questions are easy or they're not accurate. And you got somebody right here who remembers that it was on their NCLEX. Shout out to you. Is it Caramel Candy? Hi, I'm Raquel taking my exit exam for LPN. Shout out to you, Raquel. All right, y'all, here we go. Let's see. Let's see what the answer is in 3, 2, and the answer is an electrocardiogram. A lot of people get it mixed up because they're talking about, like when we talk about an echo, right? But it is indeed an electrocardiogram, and it's the quickest, most accurate, most widely used tool to determine the location of the myocardial infarction. Because you got to think, when a myocardial infarction happens, right? What part of the EKG does it happen? Think about it. We talk about it, right? We talk about STEMIs. or NSTEMIs, right? We're talking specifically about a STEMI. Where does it happen? You can see it. ST segments, right? Specifically elevated ST segments, right? So your EKG, I'm telling you, when you see it, you won't be like when you see it, you'll never be able to unsee it, and you'll never be able to be like, oh, I don't know what that is. No, you'll be like, that looks like a STEMI to me. You see what I'm saying? That's why it's important that we understand what our EKGs look like. All right. Also, we understand what do we do when those happen. All right. Question number 8. What is the first intervention for a client experiencing myocardial infarction? Is it morphine, oxygen, nitroglycerin, or obtain an electrocardiogram? Keyword is first. What is the first thing? The stem of the question has given us no other information other than what is the very first thing that we do. All right. Remember, I know that they're experiencing a myocardial infarction. What tells me that that they're having one? Right. So what do we think? All right, we got B. Somebody's telling me D. Now let's think about this. What is the first intervention for a client experiencing a myocardial infarction? Well, just like the previous question, the way to determine that you're having a myocardial infarction is an electrocardiogram. So I won't know that I have one until I've had that. So I don't need to obtain an electrocardiogram because I already know that they're experiencing it. The question tells me that. So what is the very first thing that I want to do after that? And let's see what the answer is. No, it's not MONA. Okay, let me take that back. MONA is the acronym to remember what to give, but it does not go in that specific order. All right, but here we go. But the answer indeed is B. I want to administer oxygen. All right, administering supplemental oxygen. Administer supplemental oxygen to the client is the first priority of care. The myocardium is deprived of oxygen during an infarction, so additional oxygen is administered to assist in oxygenation and prevent further damage. That's part of physiological adaptation, which is the third largest section on the NCLEX exam at 11 to 17%. LPNs, same content. You learn the same exact content, right? The same exact content that the RNs learn, okay? It says, Lakira says, I passed. Whoa, I passed. I was in here on Friday and took NCLEX Saturday. Thank you. And happy Nurses Week. Lakira, shout out to you. You are number 2 to come in here today to tell us that you passed NCLEX. I do remember you coming in here telling us that. So shout out to you, ma'am. Welcome to the greatest shit show on earth, known as being a nurse. If there's a piece of advice that you could give to every nursing student or nurse out here when it comes to taking their NCLEX exam or not quitting and giving up, ma'am, what would that advice be? And once again, congratulations to you. Everybody give Lakira some love right now, because let me tell you something right now. So many people come up to me and say that, Kevin, the NCLEX is easy. I didn't ask you if it was easy. I'm just telling you that if it was as easy as everyone says that it is, then we would have a 100% pass rate. We would have a 100% pass rate. So there's difficulties that come with this exam, from language barriers to not understanding content to not being able to apply it to questions. It depends. There's a lot of things that go on. All right. So it says, don't quit. I'm a single mom of 2, work Monday through Friday, 8 to 4:30 and school 5 to 10. If I can, you can. That's what I'm talking about. Look at that. I'm going to post that too, because we uplift around here. All right, here is our question. What is the most appropriate nursing response to a myocardial infarction client who is fearful of dying? Is it A, tell me about your feelings right now? B, when the doctor arrives, everything will be fine? C, this is a bad situation, but you'll feel better soon? Or D, please be assured we're doing everything we can to make you feel better. Remember, so now we're talking about us. Think about it. It's a psychosocial. Right? Who said that? It says it's tricky. It's all about critical thinking, not just content. So you have to have a good mix, right? The NCLEX knows that you get content while you're in school. So they fully expect for you to know the information when you come there. All right. They fully expect for you. So if you try to tell them, oh, I didn't get this in school, they don't care. You're expected to get it in school, right? Now, what you need to learn after that fact, or even while you're in school, is how to answer the questions correctly. Because remember, it's about critical thinking, as you said, and using your critical thinking to make a good, safe clinical judgment, all right? That's what NCLEX is about. This one right here, psychosocial, we're talking about, this is a psychosocial question, good therapeutic communication skills, right? So let's see what the answer is. And the answer indeed is A. Tell me about your feelings right now. Validation of the client's feelings is the most appropriate response. It gives the client a feeling of comfort and safety. Psychosocial integrity, which is 6 to 12% on the NCLEX exam. How often do you do lives? I do lives Monday, Wednesdays, and Fridays at 5:30 Central Standard Time, Omega. All right. So think about it. With psychosocial integrity, with psych patients, safety is paramount. All right. Good, open therapeutic communication skills that keeps your patient talking. All right. It keeps your patient talking. No close-ended sentences or anything like that. No yeses, no nos. You want to keep them talking. All right. So shout out to y'all that got that right. If you got it wrong, circle back. Circle back. All right. Here we go. Question number 10. Which of the following classes of medication protects the ischemic myocardium by blocking catecholamines and sympathetic nerve stimulation? All right. Is it beta blockers, calcium channel blockers, narcotics, or nitrates? Hey, shout out to all 50 of y'all out here rocking. We are doing NCLEX questions. I got them off nurseslabs.com. They are free sets of questions. Make sure you guys go over there and check them out for yourself. I want to know who you are, where you're from, where you're at in your nursing journey. And if you're not a nurse, what are you doing here hanging out with us? Also, a little bit about me. I've been a nurse for almost 4 years. I was in the Navy for 16. I've been a master instructor for 9. I failed my NCLEX 3 times. Not once, not twice, but 3 times. Shocker, right? So let me tell you something right now. For everybody that's going to take the NCLEX, or if you failed a test, or if you failed your exit, or if anything that you consider to be a failure, it's okay. Y'all hear me? Like, scream it. Like, let me know that it's okay. It's okay for you to not be successful at something, but it's never okay for you to quit. It's never okay for you to quit. You put in the work to get into nursing school. You put in the work to get through nursing school. Don't let this exam or anything for that matter stop you from doing what you need to do. Hey, give me some love in the chat. Like, I need something. I need some love in the chat. I need some likes. I need something. I need to know that y'all are hearing me. All right. I need to know that y'all are hearing me. It says I failed my exit twice. And now I'm a big nurse. Look at that. Look at that. Look at that. Failed that exit twice and still over here doing your thing. All right. So shout out to you. It says, thank you for your encouragement. Of course, this is what I do. This is what I do all the time. Look, I failed my NCLEX 3 times, passed on the 4th. When I finally told people at work, they couldn't believe the fact that I failed. And they were just like, I would have never guessed that because you're a great nurse. And I was like, yeah, because this test doesn't determine what type of nurse that you're going to be. Only you can do that. If you're a shitbag, you're going to be a shitbag. So unshitbag yourself. You know what I'm saying? But the answer is A. It's beta blockers, all right? Beta blockers work by blocking beta receptors in the myocardium, all right, reducing the response to catecholamines and sympathetic nerve stimulation. They protect the myocardium by helping to reduce the risk of another infarction by decreasing the workload of the heart and decreasing myocardial oxygen demand. That is pharmacological and parenteral therapies. Second largest section on the NCLEX exam at 13 to 19%. LPNs, you got to know the same content that RNs have to know. You also need to realize and recognize that it is about scope of practice. You need to know what you can and can't do, what you can and cannot accept. All right. It's not a state test. This is a national exam, and the national exam says there's things you can and cannot do. All right. So I want for you guys to realize that as well. Hey, ladies and gentlemen. Hey, I was on a podcast back in February, and it actually just went live last night or early this morning. All right. And it is actually with Nursing Uncensored. All right. Nurse Adrian over there runs Nursing Uncensored. It's a really great podcast. So I would recommend everybody go over there and give it a listen. It's about 52 minutes. Talks about toxicity and critical care, how I NCLEX prep and building a community online with all of y'all. It's a great listen. So you guys go over there and check it out. Also, the link is in my bio if you guys want to go over there and check it out. All right. So, hey, go over there and give it some love. It was a good time. All right, here we go. Question number 11. What is the most common complication of a myocardial infarction? Is it cardiogenic shock, heart failure, arrhythmias, or pericarditis? My difficult part is pharmacology. Any tips? You need to understand, I call it the umbrella effect. You need to understand based off of cardiac meds, you need to know what falls under them. You need to know what their suffixes are, the family names, and then you need to know what each one of the medications does. All right. And once you understand what they do, you need to understand the safety implications when it comes to administering to the patient, such as, do we do vital signs before we give digoxin? Right? Do we draw potassium before we get digoxin? All right. So on and so forth. That would be my recommendation. All right. We got A's, we got C's, we got D's. Throw some D's on it, on it. All right. Well, let's see. Let us see what the answer is. Hey, y'all, we're on the road to 20,000 likes. Y'all know what to do. Aaliyah, you are welcome. All right, y'all. Here we go. Here's our answer. In 3, 2, and the answer is C. It is arrhythmias. All right. It is arrhythmias. Arrhythmia caused by oxygen deprivation to the myocardium is the most common complication of a myocardial infarction. Physiological adaptation, third largest section on the NCLEX at 11 to 17%. All right. Hey, remember, physiological adaptation deals with pathophysiology, the disease processes. All right. Is it radiate with Amanda? I appreciate the heart me. Thank you. All right. Hey, so physiological adaptation. All right. Remember, pathophysiology, the disease processes and how they affect the body. Right. So the disease process, myocardial infarction, how does it affect the body? Right. Also, we're looking at acute injuries, such as a myocardial infarction, chronic injuries, right, and medical emergencies, which is a myocardial infarction. Okay. So you have to understand these things. All right. You have to be able to understand what things are going to be coming. All right. Here we go. Question number 12. With which of the following disorders is jugular vein distension most prominent? All right. So another way to word this is, in which disorder would you see jugular vein distension? Would it be abdominal aortic aneurysm? Would it be heart failure, myocardial infarction, or a pneumothorax? Or a pneumothorax. Think about it. Some people are telling me D. Here, we're gonna think about this right now. What is a pneumothorax, right? And what is a big thing that you would see with a pneumothorax? And when we think about veins, we're thinking about something about our vascularity, right? Air in the lungs, right? So what else helps push, what else, assists air going into the lungs? Tracheal deviation, absent breath sounds. There we go. Right. So what does that have to do with jugular vein distension? All right. This is how you have to think about that. All right. This is how we have to think about that. All right. So let's check our answer out. This is how we do our process of elimination, applying what we know versus applying what we don't know. So we're going to apply to know that jugular vein distension has nothing to do with a pneumothorax, but tracheal deviation does. Right. All right. But here's our answer. Here is our answer in 3, 2, and the answer is B. It is heart failure. Elevated venous pressure exhibited as jugular vein distension indicates a failure of the heart to pump, right? Failure of the heart to pump. That's part of physiological adaptation. Physiological adaptation, 11 to 17% on the NCLEX, making it the third largest section on the NCLEX exam. It's a part of the NCLEX test plan, the 2023 NCLEX test plan to be exact, that updated April 1st of 2023. All right. So make sure we understand that. Hey, remember, NCLEX wants you to be able to use your critical thinking so you can make a clinical judgment. Apply what you know versus trying to sit out here and guess and apply what you don't know. All right. And also RTFQ. RTFQ. If you don't know what RTFQ means, I need somebody who's a frequent flyer in my chat to drop it in there. All right. Here we go. Question number 13. What position should the nurse place the head of the bed in to obtain the most accurate reading of jugular vein distension? All right. Is it high Fowler's? Is it raised 10 degrees, 30 degrees, or supine position? What are we thinking? Shout out to all 55 of y'all. We're doing NCLEX questions. They got them off nurseslabs.com. They are free sets of questions. It says, hi from Florida. There's only one A in Florida, but whatever. Letty G says, I'm from, is it Boynton, Florida. I lived in Jacksonville for about 4 years. So shout out to Duval County. You know what I'm saying? Duval. All right, we done. But anyways, shout out to all 55 of y'all. I want to know who you are, where you're from, where you're at in your nursing journey. Make sure you guys smash that like button, you guys share, and you guys follow. That is a trifecta that gets out to the For You page. All right. But here we go. Here's our answer. Here is our answer in 3, 2, and the answer is C. It is to raise 30 degrees. Shout out to New York. Wait a minute. What part of New York you live in? Like, you either live in the city, one of the boroughs, or you live in Canada. No, I'm just kidding. But what part of New York? All right. Jugular vein pressure is measured with a centimeter ruler to obtain the vertical distance between the sternal angle and the point of highest pulsation with the head of the bed inclined between 15 and 30 degrees. That's part of physiological adaptation. Third largest section on the NCLEX exam at 11 to 17%. All right. Oh, Long Island. Okay. Shout out to you. It says Abibatu from Sierra Leone. I remember you told me that before. LPN graduating RN next Wednesday in Michigan. Shout out to you, Lacey. Shout out to you, Miami, Florida. Hey, I've been to Miami. It's kind of overrated. So help me change my mind, okay? Carrie's telling me from Florida. This Wednesday. Shout out to you, Lacey, this Wednesday. So what, 2 days? Shout out to you, Miss Lady. Shout out to you. Congratulations to all of y'all that are about to graduate and that pass that NCLEX. I'm super proud of y'all. Here we go. Question 14. Which of the following parameters should be checked before administering digoxin? Is it an apical pulse? Is it a blood pressure? Is it radial pulse? Or is it a respiratory rate? What are we thinking? Now, this is where pharmacology comes into play super heavy, right? Digoxin, right? It is a what type of medication? Okay, we're talking about pulse. Okay, so you have 2 pulses. Which one? My NCLEX exam is in 2 to 3 weeks. 2-3 weeks left, and I'm having a mental block even though I study the content. Okay, so if you're having a mental block, you definitely need to start taking breaks. Digitalis is just another name for digoxin. It's the same thing. Just like Lanoxin, it's another name for digoxin. That's it. All right, but you need to understand, we're talking about apical pulse, okay? But we have to understand what digoxin is. What category of our pharm does it fall under? What is its pharmacokinetics, meaning how does it move throughout the body? All right, and what does it affect? And then what do we do before giving it to the patient? Remember, this is a safety issue as well. Finishing my first semester with A's, mostly because I tried to jump on these lives often. Shout out to you, Sarah. Shout out to you. But let's see what the answer is. Low heart rate. Okay, well, let's see what the answer is in 3, 2, and the answer is A. It is an apical pulse. Listen, before you give any cardiac meds, you better do a set of vitals. You need to have a baseline set of vitals before you give any type of heart medication. All right. And apical pulse is essential for accurately assessing the client's heart rate before administering digoxin. The apical pulse is the most accurate point in the body. So when would we hold digoxin? Remember, it's part of pharmacological and parenteral therapies, which is the second largest section on the NCLEX at 13 to 19%. All right. Now, we have to check our vital signs for our heart. Yeah, we could check an apical pulse. Yeah, heart rate under 60. All right. If you give it to them and then you do their blood pressure you do their heart rate and it's at 55 and you just gave dig, which is going to do what? Lower their heart rate. You about to have a real big problem. You see what I'm saying? You have to do these vital signs. You have to understand pharm. And I'm telling you, it's because when I studied for the exam, I had a hard time with pharmacology, bradycardia, right? And think about it. A lot of people that are older, right, that have low heart rates. Okay. So here we go. Question 15. Toxicity from which of the following medications may cause a client to see a green halo around lights? Is it dig, furosemide, metoprolol, or enalapril? What do we think? See, these are why these questions are set up this way, is because you'd be very surprised to see a question, maybe 2 to 3 down the line, that may be rewritten to a question that you had already answered. All right. This is why it's important that we understand our content and we practice doing our questions. All right. You need content. You need questions. I'm the type of person for you to have it and not need it than need it and not have it. All right. So here we go. Let's see what the answer is. Everybody's screaming A at me. So let's see in 3, 2, and the answer indeed is A. One of the most common signs of dig toxicity is the visual disturbance known as the green halo sign. All right, that's pharmacological and parenteral therapies. Now, remember, these questions could be asked every which way because they want to enable you to use your critical thinking. All right, don't get scared by the amount of words that are being given to you. All right, I have a date soon for LPN. Shout out to you, Carrie. All right, do not get intimidated, all right? Do not get intimidated about the fact that there are more words that are being thrown at you when you get a case study. That's called recognizing cues. Which is something that they have on NCLEX, all right? So, hey, ladies and gentlemen, I have a book coming out. It's called Conquer It, The Journey to Passing the NCLEX. One thing about nurses is that every single nurse here in the United States and Canada will take the NCLEX, period. All right, period. And this book is a motivational book mixed with my personal stories and helpful tips for you to prepare for NCLEX. Remember, I failed the NCLEX 3 times. All right. And so I want this book to encourage you. Whoever, I don't care who it is, I want this book to encourage you. All right, for any challenge that you may be facing, but specifically we talk about the NCLEX, but it's good for any challenge that you're going through. All right. You guys can check that out. That link is linked in my bio. You can pre-order it right now. It comes out June 5th. All right. Hey, and if you love anything that I've ever done for you, ever, go support it. It's going to be a good read. The opening chapter, the intro, I'm really proud of that. Was really surprised that I could write that. But anyway, so y'all go over there and y'all check that out. All right, here we go. Question number 16. Which of the following symptoms is most commonly associated with left-sided heart failure? You see what I'm saying? We talked about this earlier. See how they circle back? All right. What are we thinking? Hey, if you guys are new here, welcome. We are doing NCLEX questions together. We do these questions Monday, Wednesday, Friday at 5:30 Central Standard Time, Texas time, because I live in Texas. You know what I'm saying? And Texas is in the United States. If you guys don't know that, just letting you guys know for those who are not in the United States. All right. And I want to know who you are, where you're from. Bria, I see you. I want to know who you are, where you're from, and where you're at in your nursing journey. But the answer is crackles, just like we said, because look, it looked pretty familiar from a question earlier, right? So crackles in the lungs are a classic sign of left-sided heart failure. Okay. These sounds are caused by fluid backing up into the pulmonary system. The left ventricle of the heart no longer pumps enough blood around the body. As a result, blood builds up in the pulmonary vein, which is the blood vessel that carries blood away from the lungs. All right. This causes shortness of breath, trouble breathing, or coughing, especially during physical activity. Left-sided heart failure is the most common type. Physiological adaptation, which is the third largest section on the NCLEX exam at 11 to 17%. Oh my God, Amos. Why? Where are you from? If you tell me somewhere stupid, I swear to God, I'm banning you. I'm banning you right now. Shout out to Arizona. It's hot as hell there, but shout out to you. I'm from Kenya, taking my NCLEX in a month. Shout out to you, Aaliyah. I'm from America. Is it Mahir or Mahar? What part of America? Are you in North America? Are you in South America? Which one? Louisiana. Ew. Now it makes total sense now. Georgia Peach. Girl, I see you. Is it Ziamara? Shout out to you, Ziamara. California, I got you, Mahar. Holly says, Oki here. Are you from Oklahoma? Or are you in Okinawa, Japan? Which one? I'm from the Bahamas. Shout out to the Bahamas. I like the Bahamas. It's nice over there. Oh, you live in San Antonio? Shout out to you, Miss Lady. Here we go. It says I made a 1278. Vahan, my goodness. On my mid-curricular last exam. I couldn't wait to tell you. I love to hear it and I love to see it. A 1278, ma'am. You killed that exam. Congratulations to you. I had no doubt you were going to rock that thing. Holly says Oklahoma. Oh, okay. See, you see what I did there, though? I thought it was Okinawa, Japan, because in the Navy, we call it Oki. All right. Here we go. Question 17. Which of the following disorders would the nurse expect to assess sacral edema in bedridden clients? All right. Is it diabetes mellitus, pulmonary emboli, renal failure, or right-sided heart failure? All right. What are we doing? We got D's. We got A. Let me see something. I think yeah, okay. Kiki is telling me D. Ziamara is telling me D. Oh, you live in San Antonio? Yeah, that's right. Me. I live in San Antonio too. So shout out to all my San Antonians, all my Texans out here. Y'all know how we do. Go Cowboys. I don't want to hear nobody else's mouth. I don't care about LSU. I don't care about the New Orleans Saints. I don't care about nothing about Louisiana. The boot is trash. I said what I said. Here we go. Oh, y'all are funny, y'all. Here we go. That's right, Cowboys. Hey, we're going to the Super Bowl. Hey, we delusional. Here we go. That's all good, though. But the answer is D, right-sided heart failure. All right? Hey, when you think about right-sided heart failure, think of retained fluid. Right side is the retained fluid. All right? The most accurate area of the body to assess dependent edema is in a bedridden client in the sacral area. The sacral or dependent edema is secondary to right-sided heart failure. All right, that's physiological adaptation, 11 to 17% on the NCLEX. All right, making it the third largest section. LPNs, same deal. All right, you learn the same content as RNs do. All right, you learn the same content that RNs do. Okay, so make sure you understand this. If you don't, circle back and understand, and make sure you read your rationales. Remember, RTFQ, RTFA, and RTFR. If you really want me to tell you what they are, because I don't have no problem doing that, you let me know. Here we go. Question 18. Which of the following symptoms might a client with right-sided heart failure exhibit? All right. Is it adequate urinary output, polyuria, oliguria, or polydipsia? Tell you? You want me to tell you? Which one you want me to tell you? You want me to tell you all three? All right. RTFQ means read the fucking question. RTFA means read the fucking answer. RTFR means read the fucking rationale. You can change the F word. You can change the F word however you feel comfortable. All right. But if you're going to be a nurse, I'll let you know the F word is everybody's best friend. All right. I'm just letting you know that right now. You're dead. Look, I said what I said. All right. Here we go. Here we go, y'all. Here we go. Here's our answer. All right. Here's our answer in 3, 2. And the answer is oliguria. Remember, with right-sided heart failure, we retain fluid. So we're retaining fluid and I have swelling in my extremities and in my body. That means I'm not pushing any fluid out. All right. That means I'm not pushing any fluid out. Oliguria means decreased urine output, right? Or absence of urine output, no urine output, right? So here we go. Inadequate deactivation of aldosterone by the liver after right-sided heart failure leads to fluid retention, which causes oliguria. All right, oliguria is a late finding in heart failure and is found in patients with remarkably reduced cardiac output from severely reduced left ventricular function. All right, that's physiological adaptation. Physiological adaptation, third largest section on the NCLEX exam at 11 to 17%. All right. Third largest section. I'm gonna pull my Dr. Umar and start saying it 3 times to make sure y'all hear me. All right. But shout out to y'all. Hey, if you got it wrong, RTFR. Even if you got it right, always read your rationales because you will learn something that you didn't learn previously. Trust me when I tell you this. All right. Hey, but if you don't want to take my advice, whatever, do you, boo? Here we go. Question number 19. Which of the following classes of medications maximizes cardiac output in clients with heart failure by increasing ventricular contractility? Is it beta blockers, calcium channel blockers, diuretics, or inotropic agents? Kidneys won't perfuse as good. Amos is telling me, I can't really see what your answer is. It's like my phone is buzzing it out. Oh, well. I'm pretty sure I was wrong anyway. Hey, welcome to all 53 of y'all out here rocking. We're doing NCLEX questions. I got them off nurseslabs.com. Free sets of questions. You guys go over there and check them out for yourself. Also, I want to know who you are, where you're from, where you're at in your nursing journey. Make sure y'all keep smashing that like button. Hey, we're almost at 20,000 likes, y'all. 20,000 likes. Hey, get us there. Get us there right now. Get carpal tunnel for me. Don't come over here and get all this knowledge and not leave me something. Come on now. I'm confused. It's either B or C. Give me one. So Mahir or Mahar, I'm sorry. One thing about when you study, if you get it wrong, it's okay. Because when you get it wrong, you now have data that is given to you to see why your answer is correct or why your answer is incorrect. That's why it's important. Stop being fearful of failing, ladies and gentlemen. Stop being fearful of training yourself. All right. You're going to get it wrong, and that's okay. You're not going to know everything. You're not expected to know everything. All right. Go through it, even if you get it wrong, and understand why you got it wrong. Just like being a parent. Your first kid, hey, it's a trial and error. So it's a miracle they stay alive. Usually you're a pro by the time you have a second kid. You see what I'm saying? So here we go. And our answer is D, inotropic agents. Inotropic agents are administered to increase the force of the heart's contractility or contraction, thereby increasing ventricular contractility and ultimately increasing cardiac output. That is part of pharmacological and parenteral therapies, which is the second largest section on the NCLEX exam at 13 to 19%. All right, LPNs, you got to know the same thing. You have to know the same content that RNs have to know. All right. Hey, who can give me an example of an inotropic agent? I'm going to go to the next question, but I want to know what's an example of an inotropic agent? All right. Here we go. Question 20. Stimulation of the sympathetic nervous system produces which of the following responses? Epinephrine. Okay. Epi. What else? What's another one? Epi. Levo. What else? Dobutamine. That's the one I was looking for. And I'm looking for one more. Two more. Norepinephrine's one. Yep. And what's another one? Dopamine. There we go. That's what I was looking for. But y'all gave me the example, so shout out to y'all. Hey, they could ask you these questions on NCLEX, so you need to know what an inotropic agent is and what it does. All right, increases cardiac or ventricular contractility, right? Increasing the heart rate, right? Constricting the blood vessels. Yes, yes. Is it Lantra? Shout out to you. What's up, Lantra? How are you? Hopefully I'm saying your name right. But let's see what our answer is. From bradycardia, tachycardia, hypotension, or decreased cardiac or myocardial contractility. All right, and the answer is B. It's tachycardia, stimulation, stimulation, right? Remember, stimulants like caffeine increases what? Don't tell me sorry. That's okay. You got it. All right, so stimulation of the sympathetic nervous system causes tachycardia and increased contractility. Norepinephrine released from neurons via the the stellate ganglion increases heart rate and shortens atrioventricular conduction via the sinus and atrioventricular nodes. Physiological adaptation, the fight or flight. There you go. All right. Oh my God, physiological adaptation, third largest section on the NCLEX exam at 11 to 17%. All right, 11 to 17%. Remember, hey, if you got it wrong, that's okay. It's okay. Listen to me. I need for y'all to let me know. Yeah, give me 20,000 likes right now. I need for y'all to know that it is okay if you don't do well while you're practicing. Ladies and gentlemen, the queen is in the building. I want y'all to, she didn't think I saw her, but a blessed RN. If y'all have any problems with dosage calculations, a blessed RN is in the building. That is the queen of dosage calculations. I'm about to pin her eyeballs right now. Y'all need to go over there and follow that lady right now. All right, y'all need to go follow that lady right now, because if you have any problems with dosage calculation ever in nursing school, she got you. NCLEX, she got you. Hey, if you're a new nurse, she got you. All right, go over there and follow her. All right, and she'll get you right. But check me out. Hey, I got some free test taking tips for y'all to conquer the NCLEX. You see what I'm saying? And it's free. It was one of my ebooks that I'm giving away. All right. And it's not going to be there forever. So make sure you guys go over there and you guys check that out. All right. thebootnurse.com/test, or you guys can go check it out. It's linked in my bio. So make sure you guys go check that out, as well as go follow Nurse C and go get your dosage calculation on. You know what I'm saying? Here we go. Question number 21. Which of the following conditions is most closely associated with weight gain, nausea, and decrease in urine output? It says, I love to see creators supporting each other. Brown sugar. Ma'am, this is what we do. Ma'am, you are welcome. You know, I got you. We do this all the time. Like, you know, we build not only do we build the community amongst students, we build the community amongst one another, because I want people to really answer this question. Who's going to teach us but us? School surely has these higher levels of education, surely have failed in a lot of aspects. All right. So who's going to teach us but us? And that's what we do. All right. And that's what we're going to continue to do. All right. But here's our answers. Angina pectoris, right? Cardiomyopathy, left-sided heart failure, or right-sided heart failure. Bernadette says true. It says each one, teach one. Love it. See one, do one, teach one. That's what we do. Get out here. We learn it and we teach it to other people. You know what I'm saying? Because no one's going to teach us but us. It's kind of like, you know, no one's going to raise your kids but you. So you want to raise your kids to be right. You know what I'm saying? But here we go. Here's our answer. The answer is D. It is right-sided heart failure. Weight gain, nausea, and decrease in urine output are secondary effects of right-sided heart failure. Here, the right ventricle of the heart is too weak to pump enough blood to the lungs. This causes blood to build up in the veins, which is the blood vessels that carry blood from the organs and tissues back to the heart. The increased pressure inside the veins can cause fluid out of the veins into the surrounding tissue. This leads to a buildup of fluid in the legs, or less commonly in the genital area, organs, or the abdomen. All right, in the belly. That's part of physiological adaptation. Physiological adaptation, which is the third largest section on the NCLEX exam, at 11 to 17%. All right, 11 to 17%. Remember, you have to understand these disease processes, because NCLEX is going to test you on the common things that we see as nurses. Right side of heart failure, common. Left side, common. Myocardial infarctions, common. DKA, common. Diabetes, anything, common. All right. So you got to realize that they're going to test your competency on common things that are seen within the nursing field. Okay. So it says we all should teach each other. We all should. But, you know, Bernadette, not everybody Not everybody is a teacher, and people out here are selfish. All they care about is themselves, even as nurses, so, and you can't blame them for however they are, let them do them. But there's a select few of us that love just giving back. What's up, Geraldine? What is the most common cause of an abdominal aortic aneurysm? Is it atherosclerosis, diabetes, hypertension, or syphilis? You nasties. What do we think it is? Everybody screaming A. Somebody's telling me C. Okay. All right. A. Maritza. Or is a Maritza, not Maritza. Maritza. There we go. Nah, it's C. You sure? You sure? You gonna die on that hill? One of the Kikis is telling me C. All right, well, let's see. See what I did there? Let's see. All right. All right, y'all, here we go. Here's our answer in 3, 2. And the answer is A. The answer is A. Atherosclerosis. Who's a true nurse, Jim. Hey, what's up, Miss Lady? How are you? Atherosclerosis, not C. Hey, look, I've been on this Michael Jackson kick. You know what I'm saying? Atherosclerosis accounts for 75% of all abdominal aortic aneurysms. What you mean? Hell, yeah, look at you. Plaques build up on the wall of the vessel and weaken it, causing an aneurysm. A AAA is thought to be a degenerative process of the aorta that, the cause in which remains unclear. It is often attributed to atherosclerosis because these changes are observed in the aneurysm at the time of surgery as part of physiological adaptation. 11 to 17% on the NCLEX, making it the third largest section on the NCLEX exam. Whoa! Hold on. I just found out I passed NCLEX today. Yes, Lord. A happy Nurses Week to all my nurses that are now nurses, nursing students. This isn't for y'all because y'all ain't there yet, but there is a student nurses week. But this is for the nurses. Y'all are going to be here. Trust and believe me. But ma'am, let's go ahead and pin it. Let's pin it right now. Hey, you with the face and the glasses and the gyms. Congratulations to you. Welcome to the greatest shit show on earth, known as being a nurse. It says, I found you through Nurse Amber. Yeah, Maritza, I remember. What's up, Miracle? Hey, welcome to the greatest shit show on earth, known as being a nurse. If there's a piece of advice that you could give to anyone in regards to taking the NCLEX, man, what would it be? And once again, of course, congratulations to you. I'm a Filipino RN dreaming of US RN. Is it Vina? What's up? I remember you, Vina. So Vina, I'm going to tell you just like I told you last time. All right, turn that dream into a reality. All right, turn that dream into a reality. It will be here. Trust and believe me. All right, here we go. Question 23. In which of the following areas is an abdominal aortic aneurysm most commonly located? Is it distal to the iliac artery, distal to the renal artery, adjacent to the aortic branch, or proximal to the renal arteries? What are we thinking? What are we thinking? Shout out to all 71 of y'all. We're doing NCLEX questions. I got them off nurseslabs.com. They are free sets of questions. Go over there and check them out for yourself. All right, go over there and check them out for yourself. It says those who took the exam, can you pause and take a bathroom break? Yes, you can. Angelica, you can take as many breaks as you want. However, your NCLEX is on a running clock. Okay, so you get 5 hours to take the exam. So let's just say you get to question 60 and you're just like, oh my God, I have diarrhea, right? You probably wouldn't tell us that, but let's just like, oh my God, I have to go to the bathroom. Okay. You'll raise your hand. The proctor will come and grab your testing, your scratch paper, your marker, and all that other stuff. They will log you out, and then you can go to the bathroom. However, your time does not stop. All right, it will keep going. So if you're gone for half an hour, then half an hour of your exam is gone. Which is why when I coach people, I want us to build endurance together. All right, I want you to be able to sit and to get through as many questions all the way up to 85 before you decide that you want to take a break. All right. Because that's the minimum. That's the minimum amount of question that you're going to get asked. All right. But the answer is B, distal to the renal arteries. All right. After tomorrow, I have the exam. So you have your exam on Wednesday. It says, I'm a scrub tech. I can hold forever. Tweedledee. Listen, I've sat in on not sat in. I've been in plenty of ortho cases and when I was a tech listen. Yep. I've been in some of those cases where they take forever. All right. Yeah, I got you though. All right. But the portion of the aorta distant to the renal arteries is more prone to an aneurysm because the vessel isn't surrounded by stable structures, unlike the proximal portion of the aorta. Okay. That is physiological adaptation, which is the third largest section on the NCLEX exam at 11 to 17%. You guys should be starting to pick up a theme here. All right. You should start picking up a theme. Mahar, hey, you're going to be ready for that exam. Tomorrow, take a break. Like take a break and try to relax. If you've been studying correctly, there's no need for you to cram tomorrow, because if you don't know it by now, you don't know it at all. And that's the truth. If you're trying to cram all the way up until your exam, that means that you have not been studying correctly for yourself. And if you don't know it by now, you don't know it at all. Just keeping it out, keeping it all the way a stack. I think that's what the kids say. Anyways, you're welcome. A pulsating abdominal mass usually indicates which of the following conditions. All right, is it an abdominal aneurysm? Is it an enlarged spleen, gastric distension, or gastritis? What are we thinking? What are we thinking? All right, I think we have a general consensus of what everybody's thinking. So let's see. Let's see. And the answer is not C. It is A. It is an abdominal aortic aneurysm. The presence of pulsating masses in the abdomen is an abnormal finding, usually indicating an outpouching in a weakened vessel, as in an abdominal aortic aneurysm. The finding, however, can be normal for a thin person. That's cool. Physiological adaptation. Hey, remember, like I was saying, with physiological adaptations, all right? Acute, chronic issues, medical emergencies, understanding the disease processes and how they affect the body. Boom. That's what an abdominal aortic aneurysm is a part of that. Okay, so shout out to y'all for getting it right. And if you get any questions wrong, circle back in RTFR. Who remembers what that stands for? RTFR. All right, here we go. Question 25. What is the most common symptom in a client with abdominal aortic aneurysm? Is it abdominal pain, diaphoresis, headache, or upper back pain? A, D, A, D. Holly is telling me B. Is it Sis is telling me D. Oh, now it's going fast. Maritza's telling me D. Geraldine's telling me D. Kathleen, Kiki's telling me D. All right, let's see. Let's see what our answer is, y'all. Let us see what our answer choice is in 3, 2, and the answer is, whoa. Okay, yeah, thought it was something wrong. The answer is A. It is abdominal pain. Abdominal pain. All right, abdominal pain in a client with abdominal aortic aneurysm results from the disruption of normal circulation in the abdominal region. What's up, Range Rover? How are you? All right, where are we at? Hold on one second, y'all. TikTok don't want me to be great. They're just like, are you still here? You know I'm still here. What kind of question is that? Here we go. Patients may experience unimpressive back, flank, abdominal, or groin pain for some time before rupture. Isolated groin pain is a particularly insidious presentation. This occurs with retroperitoneal expansion and pressure on either side of the left or right femoral nerve. Okay. This symptom may be present without any other associated findings, and a high index of suspicion is necessary to make the diagnosis. Physiological adaptation, third largest section on the NCLEX exam at 11 to 17%. Lala says, I'm peachy and yourself. I see you still running the shit show. You know it. You know I'm still out here running it. I've been running. Hey, listen, I've been doing these TikToks for like over a year now, so it's like now it's a part of my routine. So I'm going to keep running it until it's not a shit show anymore. So that means I'm going to be running it until I'm no longer here. So shout out to y'all for getting it right. If you got it wrong, circle back and understand why you got it wrong. Read your rationales, okay? Hey, ladies and gentlemen, another quick one. I was on a podcast called Nursing Uncensored. Hey, I specifically was talking about toxicity in critical care. Why? Because it's there. And I don't got no problem telling y'all, because that's my experience. I don't give a shit about nobody else's experience if they want to come for me and act stupid. But that was my experience. All right. We talk about NCLEX prep, because that's what I'm here for y'all for, and building a community with all of y'all on TikTok as well as off of TikTok. All right. And it was a good time with me and Nurse Adrian. So you guys go over there and check it out. Hey, if you go to Spotify or iTunes or whatever, type in Nursing Uncensored and it'll be the first one that pops up. All right. And my episode went live actually midnight tonight. or midnight last night. So you guys can go over and check it out. It was a good time. And if you guys are actually a part of her Patreon, you guys get the video version. So if you guys want to go check her out, she puts out a lot of good stuff and interviews a lot of good people that are in our space. All right. So you guys go over there and check that out. All right. Question 26. Which of the following symptoms usually signifies rapid expansion and impending rupture of an abdominal aortic aneurysm? You guys starting to see how there's only so many ways that you can write a question. There's only so many ways that you can write this question. But now we're essentially going back and forth about the signs and symptoms of somebody who would have an abdominal aortic aneurysm. So I expect that any of you that get this question on NCLEX would be able to fly right through it. All right, so abdominal pain, absent pedal pulses, angina, or lower back pain. Got some people saying D, some people saying A. Hey, if you guys are just now joining, we're doing NCLEX questions. Got them off nurseslabs.com. We're on the road to 20,000 likes. I think people got tired. I don't know why. So all I'm saying is I just want 20,000 likes. Stop being greedy out here. All right, here we go. Let's see what our answer is. Remember, with our abdominal aortic aneurysm, our triple A's, what are our signs and symptoms that exhibit that? All right. Here we go. And the answer indeed is D. Lower back pain. All right. Lower back pain results from the expansion of an aneurysm. All right. The expansion applies pressure in the abdominal cavity, and the pain is referred to the lower back. That is part of physiological adaptation, which is the third largest section on the NCLEX exam at 11 to 17%. LPNs, you need to know the same content that RNs need to know. All right. It's just the scope of practice is different. You need to know what you can and can't do and what you can and cannot accept. This is not a state test. This is a national test. And a national test says that there are things you can't do. All right. No one cares about what your state says. I was letting you know. So don't get mad at me. Don't shoot the messenger. All right. So shout out to y'all. Here we go. On to the next one. Oh my God. Y'all got me to 20,000 likes. Y'all shouldn't have. Here we go. Question 27. What is the definitive test used to diagnose a AAA? Is it an abdominal x-ray, angiogram, CT scan, or an ultrasound? What are we thinking? C. Sunshine telling me B. A, B, and C. Oh, because y'all all over the place. Key word is definitive. Definitive. What do we think? We got C's, the D. Stop it. I really just said that too. I really just repeated it. Oh my God. Blessings is telling me C. Rose is telling me C. Okay. We got D out here. Okay. Man, y'all all over the place. Y'all all over the place. Well, let us find out what the answer is. Let us find out what the answer is, y'all. Here we go. In 3, 2. Range Rover's telling me B. Rosie's telling me C. Brown Sugar's telling me D. Okay, cool. Let's see. Here we go. Here's our answer. And the answer is B. It's an angiogram or arteriogram. I'm sorry. Arteriogram, not angiogram. Arteriogram. All right. An arteriogram accurately and directly depicts the vasculature. Therefore, it clearly delineates the vessels and any abnormalities. All right. Gram is the key. Shout out. It is a gram, right? Arteries, right? We're talking about a AAA. So now we have an exam that does strictly for the AAA, right? So reduction of risk potential. This is a different section of the 8. Reduction of risk potential, right? Which is 9 to 15% on the NCLEX exam, making it the 4th largest section on your exam. All right. Management of care, pharmacological and parenteral therapies, physiological adaptation, and reduction of risk potential make up more than 50% of the entire exam. All right. More than 50%, right? That's 4 sections that make up half, and the other sections make up less than half. All right. The other 4. All right. So that tells you where the heavy hitters are. So shout out to y'all for getting that one right. If you got it wrong, circle back, understand why you got it wrong. All right. Here we go. Question 28. Which of the following complications is of greatest concern when caring for a preoperative AAA client? Is it hypertension, aneurysm rupture, cardiac arrhythmias, or diminished pedal pulses? What are we thinking? We got B's. We got a D. We got B's. Every time I see Brown Sugar's name, I'm like, sugar, dun, 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 dun. Oh, honey, honey. Anybody? No? All right. I'll leave. Natalie's telling me B. Stop it. I think that's my ADHD kicking in. Shout out to all 70 of y'all. We're doing NCLEX questions. Wait, where are you going? What? Hey, no, don't leave me. Don't leave me like that. Don't leave me like that. All right, y'all. Here we go. Here's our answer in 3, 2, and the answer indeed is B. It is an aneurysm rupture. Rupture of an aneurysm is a life-threatening emergency and is of the greatest concern for the nurse caring for this type of client. The layers of the aortic wall can be separate, so aortic dissection. This produces severe tearing pain in the chest, back, or abdomen. The potential for rupture is the most serious risk associated with an aortic aneurysm. A ruptured aortic aneurysm can cause life-threatening internal bleeding and or a stroke. That is reduction of risk potential, which is 9 to 15% on the NCLEX, making it the 4th largest section on the NCLEX exam. All right, 4th largest section on the NCLEX exam. Hey, listen, AAAs are not a game. All right. And when you have one that ruptures, trust me, they'll tell you. And then when you see them decompensate, you're going to be like, wait, what happened? Well, let me tell you, it's a lot scarier when you see them in person. Just like when you see a pulmonary embolism, I'm telling you right now, when you see one ever in your life, you will never forget it. I saw a pulmonary embolism my first time. When I tell you I've never frozen up and I've done a lot of things in life, that one time I was like, oh my God. Like I said it out loud too. And so the only thing I knew what to do was to hit the code blue button. So I'm trying to tell you. All right. It says, saw one in surgery. Thank God they made it. So I'm telling you, it's crazy. It's crazy. Here we go. Question number 29. Which of the following blood vessel layers may be damaged in a client with an aneurysm? Is it externa, interna, media, or interna and media? What are we thinking? All right. Is it Bella? Bella's telling me C. Holly is telling me D. We got B's, we got C's. Throw some D's on it. All right, Kiki's telling me D. I've seen one. The patient told me he felt like something popped and then he coded. Listen. Okay. Oh my God. It's crazy. It's like when you start to see those medical emergencies when they happen, like when you see somebody who has a PE and you visually can see them struggling to gasp for air, or they're trying to bend over, or they're squirming, and then next thing you know, you see them. Listen, oh my! Every single person that's thrown a pulmonary embolism, they make the same sound. Damn, never learned this in nursing school. That's okay. What are we thinking? And then when you see somebody do with a AAA, wild. Strokes, wild. Like when you see them happen in real time. That's why this is why you have to recognize what they look like. All right, here we go. Here's our answer in 3, 2, and the answer is C. It is media. All right, it is media. All right, the factor common to all types of aneurysms is a damaged media. All right, the media has more smooth muscle and less elastic fibers, so it is more capable of vasoconstriction and vasodilation. All right, it's part of physiological adaptation, which is the 3rd largest section on the NCLEX. 3rd largest section on the NCLEX exam at 11 to 17%. Cardiovascular accidents in real time while on preceptorship almost took me out. Listen, okay? Wild. I had somebody throw a pulmonary embolism come right off the helicopter, and as soon as we moved him to the bed, like it was crazy. And that was my first code, like as a nurse. I've done codes as a tech and stuff like that, but as a nurse, when I'm in there, whoo, wild. Advice for new nurses in their department of choice. Lou, you should go where you want. If you want to go to the OR, go there. If you want to go to the ICU, go there. The biggest thing when you go there is to be a sponge. Find a good preceptor and a mentor who's going to guide you, as well as express yourself on things that you don't know so you can learn more of. I never get used to those codes. Listen, I remember I had, I used to take showers when I got home, and the hot water would be running over me, and my face would be pointed to the ground like it's a dark and dismal day. And I swear to you, I could hear the code blue button going off all the time. Like, because I worked nights at that point, it would go off all the time. Here we go. Question number 3 in my head, and it wasn't real. When assessing a client for an abdominal aortic aneurysm, which area of the abdomen is most commonly palpated? Is it the right upper quadrant directly over the umbilicus or umbilicus? mid-lower abdomen to the left of the midline, or midline lower abdomen to the right of the midline? Is your name Sepstone, like September Stone? DD is telling me A. And so it's, no, you're not. Kiki told me something different. Don't do med surge like that. September Stone. See, look. I pick up what you're putting down. Miss Lady. I pick it up. All right, so we got D. Okay. We got A. All right, I'm going to give you all 10 more seconds. What else we got? Hey, if you guys are just now joining, we're doing NCLEX questions. Got them off nurseslabs.com. They're free sets of questions. You guys can go over there and check those out for yourself. Y'all got me to 20,000 likes, so I'm happy. Like Pharrell. All right, here we go. Let's see what our answer is in 3, 2. And the answer is C. All right, it is the middle lower abdomen to the left of the midline. All right, now let's see why. All right, y'all see what I did there? Let's see why. Don't get mad at me. All right, we're about to find out. All right, the aorta lies directly left to the umbilicus. Therefore, any other region is appropriate for palpation. All right, the aortic pulse can be palpated just above and to the left of the umbilicus. The width of the aorta can then be measured by placing both hands, palms down, on the patient's abdomen with one index finger on either side of the aorta. Each systole should move the fingers apart. As part of health promotions and maintenance, which is 6 to 12% on the NCLEX exam. Health promotions and maintenance is 6 to 12% on the NCLEX exam, which is a smaller section on the NCLEX, all right? But still very, very, very much important, all right? Still very much important. So shout out to y'all for getting that right. Listen. Whether you believe that these questions are easy, whether you believe that these questions are hard, first of all, I didn't ask you that. Second of all, just answer the question. And third, understand where you are when it comes to your studying. All right. If there's something that you know that you don't understand, no matter how simple it is, go back and get the content. All right. Everybody, let me tell you something. Everybody's so quick to blame other people, but you don't realize that when you point a finger at someone else or something else, you got other fingers pointing back at you. All right. So realize that you are the problem and you need to fix it. I'm just keeping it a stack. That's what the kids say, right? So shout out to y'all for getting it right. And if you got it wrong, circle back and get that content. All right. Hey, ladies and gentlemen, once again, I have a book that's coming out June 5th. All right. You guys can pre-order it. You can pre-order it right now. Right now, the Kindle version's up there. But once the paperback version is up for pre-order, you can actually switch your pre-orders over. All right. It's called Conquer It, The Journey to Passing the NCLEX. Kind of makes sense because I helped teach the NCLEX, right? Comes out June 5th. That is my 4-year anniversary of becoming a nurse. I put so much work into making sure I got this out on that specific day. But it's a motivational book. It's exactly what you think it is. All right. It's a motivational book to help encourage every single one of you, not just through NCLEX, even though the premise is NCLEX, but through life and other types of tribulation that you may be going through. All right. Use it as motivation to do whatever you want in a positive direction. All right. So you guys can go check that out. And by the way, I'm an award-winning author. That's what that seal is. Hey, listen, when I tell you I'm in a ledger of award-winning authors, it's in there. So I'm just saying, go get you that book with that seal, baby. All right. No, but I appreciate y'all. Hey, like I said, if there's anything that I've ever done for y'all, PASS NCLEX, got you through a test, whatever, hey, go over there and check it out. Also, test taking tips to conquer the NCLEX. Hey, that used to be one of my PDFs. That I'm giving away for free. It's 42 pages of just buttery, delicious goodness. You know what I'm saying? You get everything but the kitchen sink. Oh, and minus this fanny pack. Because, by the way, if y'all don't got a fanny pack when y'all start working, what are you really doing with your life? I'm just keeping it real. Get a fanny pack, all right? Put some Jolly Ranchers in there and move on about your day, all right? But go over there and check it out. Test taking tips to conquer the NCLEX, all right? Free download. It's also linked in my bio, or you can go to that website that's right there on the screen, thebootnurse.com/test. What's going on, D? My man. It says, I've been left the fanny. But look, no. You can't leave that. Oh, and of course, hey, once again, I was on a podcast. You guys go over there and check it out. Nurse Adrian, she runs Nursing Uncensored. Great podcast. It was my second time on there. Make sure you guys go over there and check that out. Nursing Uncensored, you can find it on Spotify. You can find it on iTunes, Stitcher Radio, whatever you listen to your podcast, you guys can find it over there, okay? All right, ladies and gentlemen. And of course, hey, that's it for our questions today. I appreciate all the love. I appreciate all the support. Even though the gifts are not mandatory, they are surely appreciated. So thank you so much for those. I didn't have to ban anybody, but if they did get banned, they deserved it. And I will tell, if I could go and message him and just be like, that's why you got banned, I would. But I'm petty, over 9,000. Once again, I got the questions off nurseslabs.com. They are free sets of questions. You guys can go over there and check those out for yourself. Check out the podcast. It went live this morning, so you guys can go over there and check it out. Also, for all 70 of y'all, I have an NCLEX course. Right now, you can get it for $97. So it's 70% off. It's 70% off, right? You can get it, and you have it forever, or for however long you live, whichever comes first. And you can check that link out. It's in my bio as well. Also, if you're one of those people that failed NCLEX, you don't know where to start, you don't have a schedule, you don't have accountability, you don't understand questions and answers, you don't understand content or how to apply them all, I do coaching as well. You can check that link out. It's also in my bio. Okay. Thank you again, sir. Consistent with it. Zay, I'm always, like I said, consistent for a year. I'm always here. Say, see what I did there? Consistent for a year. I'm always here. Brown Sugar said, congratulations. Happy Nurses Month. Hey, thank you. I appreciate it. Award-winning author. C, you know what's up. Lou says, congratulations on the book. Thank you so much. Thank you again, sir. Thank you. You're welcome. Thank you for the amazing things that you... Bria, I appreciate it. Thank you. Rose says, thank you. Happy Nurses Week. Happy Nurses Week to all my nurses out there. Nursing students, y'all are going to be here one day. Y'all are going to be here. What time does this start? I missed most of it. Monday, Wednesday, Fridays at 5:30. Via says, thank you for this day. You're welcome. No problem. Thank you. Is it Eastern? No, it's Central Time. It says, so for your classes, I'm gonna get it today, but I'm going to be busy. I'm going out of town for 2 days. What exact D? Just send me an email or send me a DM. Send me a DM so I can understand what your question is, because you're only limited to a certain amount of things here. All right. You know what? I just turned this around. I'm looking kind of rough today. You know what I'm saying? So what's up, y'all? What's up? You know what? I've gotten to the point now on social media and on the internet. It's like, it don't matter how rough I look, it don't matter. It don't matter. I'm coming out here and I'm giving y'all this goodness regardless. You know what I'm saying? How do you know when you're ready to take the NCLEX exam? So the biggest thing to tell you that you're ready for your NCLEX are your questions and answers. That's the biggest thing. All right. But you need to have all these other things up there. You need to have all these other understandings while you're taking your quizzes. So content, do you not understand it? Or test taking strategies, do you not understand what the questions are asking you? That's what it is. Like, it's all accumulated into one. But the biggest thing that tells you that you're ready for the NCLEX is your test scores. And not just your test scores, but consistency with those test scores. Like, are you scoring on your quizzes, like in the 60s and mid 60s and 70s and going up? Are you scoring, are you doing well on those assessments? Are you doing well on the readiness exam? So like, the best way to know that you're ready is to test yourself for that test, AKA the test questions. All right. Hopefully that answered your question. Hopefully that is it glammed up naturally. You know what I'm saying? Hopefully that answered your question. Hey, so shout out to all 36 of y'all out here rocking. I did NCLEX questions. We did just about 30 of them. What questions do you guys have? I've been a nurse for almost 4 years. You're welcome. I've been a nurse for almost 4 years. I worked ICU, OR, and PACU. I did 16 years in the Navy, 16 and a half actually. And 9 of those years I was a master instructor. All right. And I failed my NCLEX 3 times and I passed on the 4th. No one cares, ladies and gentlemen. No one cares about how many times you took that exam. Guess what? You still gonna go where you want. If you want to go to med surg, cool. You want to go ER, cool. ICU, cool. There are certain places where they require you, depending on where you live, they require you to whatever their unit discretion is. But for the most part, you can go wherever you want. My NCLEX is Saturday and I'm scared. No, don't be scared. Don't be scared. September Stone. Like I said, if you've been preparing for it, which I know that you have, right? You've been testing yourself. You've been doing your content, not having distractions. You recreated your testing center. You're in the frame of mind for it, and you're showing progression going up. You're going to do fine. Think of your NCLEX. If you've been prepared for your NCLEX, think of your NCLEX as a super quiz. Think of your NCLEX as your super quiz. Any tips for pre-test anxiety? I can leave with 100, but I'm always nervous until I see the results. So the best way for you to get through your anxiety is to practice. Put yourself in the environment. So for example, this one's for brown sugar. So if you're at home, if you have an office or wherever, have a TV, have a your computer there, nothing at your desk, no phone, no snacks, no drinks, no nothing, and recreate the testing center. So that way, when you go to the testing center, all of that anxiety is going to be alleviated because you've already been practicing that way. I'll give you an example. When I was studying for my NCLEX and I passed on the fourth time, by the time I want to say it was around question 10, I started doing this, and I was just reading. And then I didn't realize that my hand was there until I was about at question 40, 45. And I'm like, because I was already in a position of comfort because that's how I train myself. So if you want to get through the anxiety, put forth, create the anxiety inducing now. That way you get used to it. That way it alleviates itself as you start to progress through. Hopefully, does that make sense? Hopefully that helps. I took 3 readiness tests, 2 borderline, 1 high chance of passing. Okay. What's up, Naz? Naz, ma'am, if I'm going to make you a mod, you got to be here, okay? I don't want to hear no excuses. I don't want to hear no excuses. Kevin, I was at clinicals. Kevin, I worked at the hospital. Kevin, I have a baby. Kevin, I did this. I don't care, Naz. I need you here. I'm just playing. But what's up, Naz? How are you? How are you? Hey, but so what other questions do you guys have? Kevin, I don't have a baby. Oh, I'm sorry. I'm just making shit up. Good. Don't have kids. But what else do you guys got? What other questions do you guys have? Like I said, we go live Monday, Wednesday, Friday at 5:30 Central Standard Time. Central Standard Time. So what other questions do you guys have? Got it. Got it. So when you go live, you already know it says you got to give me the schedule. I go live Monday, Wednesday, Friday, 5:30. Yep, you know what's up. You know what's up. But what other questions do you guys have? I'll hang out for a little bit. I thought today was Friday for some reason, but it's not. It's Monday, so my days kind of just run together. It says, thank you for mentioning the scorecard from the first exam. Definitely helped. What scorecard? What scorecard? I forgot what I said. Obviously, it was helpful, but I forgot what I said. But if you guys are just now joining, we did NCLEX questions. We do NCLEX questions Monday, Wednesday, Friday at 5:30. I'm writing my board exam for CIC end of this month. Any tips? What is CIC? Now you're about to make me look it up. Certification for what? Oh, infectious prevention or infection certification and infection prevention and control. I don't know. Honestly, I've never taken that exam. But I can only imagine. I feel like with that, you know what, I can't even speak on it. I mean, I can give you test taking tips that I would think would be for everybody else. You know, recreate the testing center, understand how many questions that they're going to ask you. If it's timed, you know, practice timing yourself, all that stuff. No, Naz, you got it. You got it. Is this as a nurse or is this like something that you do? Like, is it just something that you're just trying to get? Oh, it looks like it's it's a multiple choice exam. It's 150 questions. I'm over here telling you like you don't know this already. It says as a nurse, but I also have, I'm like, okay, that makes sense. Yeah, see, now that makes sense. It's a 3.5-hour exam. Okay. And it says successfully complete 5 of the courses and pass the 5th exam. And if I don't even know what that means. That sounds terrible. I love infection control and I was going to go that route, but then I realized that no, I'm just going to stick to education. So, but shout out to all 28 of y'all. We did NCLEX questions. We do them every Monday, Wednesday, Friday, 5:30. If you guys are just now joining, I want to know who you are, where you're from, where you're at in your nursing journey. And what questions do you have about nursing, about NCLEX, about school, first year being a nurse, imposter syndrome, so on and so forth. Naz, how long have you been a nurse? What are we thinking? You're not. Oh, is this oh, you're doing it because you're microbiology background, but you're in the nursing program. Okay. Yeah, that's all. last semester. So by you actually having that cert, that actually, if you're trying to go to like quality control and infection prevention, if you're trying to go that route, which I really think that you should with a microbiology background, and if you get that CIC, Gucci. And then you should get the public health. Yes, love it. Love it. You'll probably be one of those public health nurses that called me and said, you have, and I'm just like, I know you're 3 weeks late. But yeah, look into the infection control aspect for the nurses, so you can get that cert as a nurse as well. Oh, I don't know if this is the same one. I don't know, but I know the nursing has their own infection prevention certification as a nurse, not just somebody else. What's who is that? Navy vet 88 joined through the invite. Shout out to you. It says, then I'll be on my way to California. Shout out to Cali. I mean, if you want to go out there and live, don't you like live in Canada or something? It's expensive there and it's expensive in California. Why? Why would you do that? It says, what insulin onset peak duration is the right one to use for NCLEX? Every source is a little different. So every source may be a little different, but when you get a question like that on NCLEX, it's going to be like something like astronomical, right? So if we start talking about rapid insulins, it takes 15 minutes to 30 minutes for the onset. The peak is like 2 to 3 hours, and then the duration is like 4 or 5 hours. I can't remember right off the top of my head. Yeah. So when I say that, it's going to be something that's astronomically, like, you're going to be like, that don't make no sense, right? So I really don't think it would have to be, it's something astronomical as long as they're relatively close. I'm trying to put it into words to where I don't trip over myself, or somebody message me and be like, oh my God, Kevin, you said that was wrong. And I'm like, okay. Where am I based? I live in Texas. Absolutely not. It's freezing up here. I bet. I heard it is freezing. There's a guy that I was coaching who lives in Ontario, I think, or Ottawa, Ontario, Alberta, somewhere up there in one of those territories. Listen, I don't know. Don't come for me. All right. But he was telling me how freezing cold it was up there. And so I don't blame him. I don't blame you for wanting to, like, I got to go. So, but who asked me that? Stone. I'm just gonna call you Stone. Did that answer your question? I know that's probably not the answer that you wanted, and that's probably not the answer that you wanted. But the one thing I could tell you, like with Glargine or Lantus, I think it's Lantus, Glargine, like any type of long acting, that's anywhere from like 12 to 24 hours. We know that because Glargine, meaning large, it's the longest duration, which is like, I think 12 to 24 hours. Now usually with the rapid insulin, like Lispro, they won't say Lispro, they'll say fast acting or rapid acting. It's like 15 to 30 minutes. It says, I have anxiety. I'm so nervous. I don't know for sure what to stick to, though. That's okay. You send me an email? Cool. I probably just saw it come through. Now that I think about it. Let me see. But yeah. So the one thing I'll say, that's the one thing that I will say is that with Lispro or the fast acting or the rapid acting, I've seen a lot of questions for NCLEX is like, they won't ask you the time and the duration. They will ask you, your patient just received rapid acting insulin, right? Because we know insulin decreases our blood sugar, right? And they're going to ask you what you need to give them. So, like you need to give them food or rapidly, or you need to give carbs, right? Because the decrease with the insulin and the eating of the carbs is going to bring it up. So that way it balances itself. Does that make sense? That way they don't become hypoglycemic. Those are the type of questions that they would ask you. All right, D, yeah, I see your email. It said, failed this semester by 1 point, not sure if my professor will curve the grade. So here's the thing, life is short. Never expect for them to curve anything. Because let me tell you something right now, they will get rid of you when it comes to that university or that school's overall standing to maintain whatever standard. Trust and believe me, they will get rid of you. So I don't know if they're going to curve it. I know that when my exams, when people failed them, they never curved them until they were under investigation by the Board of Nursing because of the amount of people that were failing their tests and their exams, and they weren't letting people graduate. So the one thing I'll say is, I'm hoping for the best for you with regards to that, but you have to be aware. You have to be aware that that's an option that could happen. You know what I mean? So. I was wondering if we could start when I get back. So, but okay. What are we thinking? Yeah, you're welcome. No problem. Shout out to all 28 of y'all. Hey, what other questions do you guys have? Talking about NCLEX, talking about nursing. Happy Nurses Week to all my nurses that are in the building. All right. Soon, my nursing students and my nursing graduates that are in here, you guys will, that'll be y'all. That'll be y'all most definitely. Okay. And that time will come. Remember, your time comes when it's supposed to, not when you want it to. So if you were unsuccessful at something, that's okay. Now we have the data for us to go back to the lab and fix it. It could be yourself. It could be your test scores. It could be, anything. It could be anything. All right. Remember that failure or being unsuccessful gives you data. So data that you can learn from. That's the whole point. All right. So what other questions do you guys have? What other questions do you guys have? By the way, I have an NCLEX community. But it's only available to people that decide that if they want to buy the course. But I'm actually going to make that available to people that just want to come in and be a part of a community. It's only $10. It's only going to be $10. You do $10 a month. You do it for your first month. $10, cancel your subscription. Cool. You're a part of it. I do live questions in there. You get access to the live recordings. You get to be part of a community with other people that are in there. And so I'm going to be making that available. Same to you too. It says, how do I study for nursing school? I don't even know how to even answer that question. First of all, first thing I would say to you is that you would need, first of all, understand that, when you go to nursing school, first thing you need to have is time management. So I don't know what your situation is, but you need to truly have a conversation with people that are in your family, husband, wife, kids, whatever, because your life is about to drastically change because of the amount of attention you have to give the nursing school. Next thing I would recommend is when you get to nursing school, get into a small group. That way you guys can divvy up the things together. You do part of the work and reap the benefits. All right. So, but of course you still got to be a part of that. Also, realize that nursing school is a game and it's not about you and what you want to do. So these people give you rules, you follow them, period. Your fastest way through nursing school is to graduate. All right. So don't go against the grain. Don't be one of those people that are just like, that don't make no sense. I don't this, that, and the third. Nope. Don't do that. Don't do that because they'll paint a target on you and then they'll target you. Trust and believe me, they will target you. All right. We don't want that. And I don't want that for you. Now how to study for nursing school. I don't even know how you study or what position that you're even in, or if you're even in nursing school. Now, if you're trying to get into nursing school here in the United States, you need to do the prerequisites. You need to figure out what school that you want to go to, what their prerequisites recommend, and you need to do the classes that they recommend. You need to get as high as grades as you can, preferably A's. Why? Because the higher your grades are, the more competitive it makes you. All right. Because I know a lot of these schools now are on a lottery. And in places in like California, they have like a 3 to 5 year wait for people to become a nurse. Versus if you go to Mississippi, they'll take you. You know what I'm saying? So, yeah. So that's another thing that you need to do. It's definitely the prereqs. And then you need to take the entrance exam if your school offers it, which is either the HESI A2 or the TEAS A7. I think that's what it's called, right? That happened in my school. My whole class was targeted for a while. We were the bad class. It happens. I was an online student and all the online students were called cheaters. And I was like, how are we cheating? We have to go to a same testing center as everybody else. So I don't be listening to them. I failed nursing school twice. So much material in a short amount of time. That's a part of the process. Is it Shabu? That is part of the process when when you're becoming a nurse. So the whole point of nursing school is not to is to keep people out, right? And if you can't hack it, then if you can't push through it, then it may not be for you. Now, nursing school, that's just the thing. It's to keep you out, and it's going to test you on how much you want to stay in. Trust me, I can't even tell you how many days that went by when I was in nursing school. I was like, nope, fuck it, I don't want to do this no more. All the time. But you have to persevere and you got to push, right? Nothing is given to you. You have to earn it. You know what I mean? So, Naz, very well said. I appreciate your support. No, but seriously, that's exactly what it is. Nursing school is a game, and you need to know how to play it. Trust and believe me. All right. All right. What other question do you guys have? I hang out for another few minutes. That was a good question, by the way. That's so true. Geraldine, I'm trying to let them know. All right. And Stepstone, like, I don't know. They probably labeled y'all as the bad classes because like maybe people weren't doing so well on their exams. And here's another thing. Here's something that I learned when I was an instructor. If I am teaching a block and those students are not doing well or they fail at something with regards to that exam, like let's just say like more than half my class failed that exam. It's not their fault. It's mine. It's my fault as the instructor on how the information was conveyed. Even though the information's in this book, it's still my fault as the instructor if more than half my class fails that exam. You know, and so guess what? They're going to be like, oh, it's not a material problem because we know the material is here, but how did you convey it to them? And nursing schools have gotten a lot of nursing schools. I can't say all, but there's a lot of nursing schools and just institutions in general that have gotten extremely lazy. And not only lazy, but there's not enough nursing instructors out here to teach people. You know, there's not like academia at these universities. They don't even pay you well enough. You know, nurses have a hard time getting paid working in a hospital, let alone you go to a freaking an institution of higher learning. They pay you less. You know, so I don't know. It's just a weird, crazy cycle. It says, wish someone told me that a long time. Listen, I went to nursing school thinking nursing school was going to be great, thinking that it was going to be easy. Boy, when I tell you I got humbled my first semester because I almost failed it. And this is with like, you know, my experience as a corpsman in the Navy, a surgical tech, and an instructor. It was just wow. Jason's in the building, y'all. Mr. I just got my BSN is in the building. Shout out to you, Jason. I see you out there smashing that like button, my guy. Someone in my class that I'm close with failed the semester by 1.76 points. And you know, and Anna, you want to know what's really crappy about that? They're gonna fail them. They are going to fail them and make them repeat the whole semester again. The lecture teachers were awful. We didn't learn anything. Yep, that's what happens. Yeah, she will. And I'm telling you, she most definitely, listen, there was one girl I was coaching. She failed her exit exam by less than a point. And they made her retake the semester. And she just took the semester again and passed her exit. And she graduates, I think, on Wednesday or Friday, something like that. They will fail you. They don't care. They do not care. Naz, don't be laughing at me. What's wrong with you? But that's the truth. That's the truth. Hey, if you guys are just now joining, I did NCLEX questions earlier. I do NCLEX questions every Monday, Wednesday, Friday at 5:30. We went over 30 questions today. I got a new book coming out. I'm an award-winning author. That, by the way, that feels really weird to say. I'm an award-winning author. I was on a podcast, Nursing Uncensored. Make sure you guys go over there and check her out, all right? Nursing school comes with a lot of sacrifices. It does. It does come with a lot of sacrifices. The thing about it is, like, what are you willing to sacrifice to become a nurse? Temporarily. I know some people that, I'm telling you right now, like, relationships end. Every January, February, every August, September, relationships be ending. It'd be crazy out here. My sanity, I know that's right. Like, Naz, you were less crazy before nursing school. Now you're even more. I'm just playing this. The teacher came from level 4 where more than half failed, and now he's teaching level 1, and people are still failing. Ain't that something? Ain't that something? You're not wrong, Naz. You probably are crazy. You probably are crazy. You stay away. All right. He said, "Yep, I ended up getting a divorce." Look, listen, we could sit here and we could talk about it. It could be a therapy session. You feel me? Because it happens in a lot of other programs, but we could talk about it. It's not a big thing. Award-winning author. Listen, hey, certified with a stamp on it. You know what I'm saying? This is a trauma bond set. It is. Listen, I have I have trauma bonds. Like my 2 deployments in the Navy, trauma bonds. My first wave of COVID, my wave of COVID when I worked in the ICU, there's like 3 or 4 nurses that I have a trauma bond with still to this day. One of them is like a really good friend of mine. All right. So, hey, listen, more award-winning nurses. Listen, there's a bunch of them that are out here. All right. There's a bunch of them that are out here. Nursing school is the struggle, but find your support system and keep pushing. Y'all got this. Hey, Jason's telling y'all that. Jason actually was one of my coaching students when he got his ADN. Now, man, got his RN. He got his BSN out here. You know what I'm saying? Doing his thing. I'm proud of you, bro. I'm proud of you. But yeah, this is a trauma. This could be a trauma bonding session. You want to know why? It's because at least all of us, we all have the same thought process of nursing school. All right. At least that's what we can all bond on at this point, right? So, but yeah, it's all a part of the process. It's all a part of the process. I can't even tell you how many people broke up, got a divorce, had a baby, had a second baby. Like, it's wild. And I'm just like, wow. So it's crazy. It's crazy. So what other questions do you guys have? I'm going to hang out for a few more minutes. I know I've been saying that. So what other questions do we got? Hey, if you guys are just now joining, hey, we're just trauma bond talking here. And we never had a warning. Dad, you never really get a warning. You don't. I struggle my second semester. Now I'm nervous about starting my last semester. Any advice? You're in your last semester and you struggle. Your final semester, they're really like the biggest thing now, like I said, is be a part of a group. Like have the group mentality. Let's say it's you, 3 other people. Split up the work evenly. You do 25% of the work, so on and so forth. You do that amount of work and you reap the benefits, right? That's the biggest thing. But the biggest thing is understanding the transitional aspect, management, leadership, delegation, pharmacology. All that's going to hit you at the end when you do your exit exam. All right. So you need to understand that. Don't ask me about ATI. I've never taken it. HESI, trash. And I didn't like it. But then again, that was 6 years ago. So I have no idea what the updates look like for it. I don't even recommend people use it. I don't because I don't like it. So that's just me. But all right, y'all. I appreciate everybody that came through the live stream today. I also have another podcast that's going to be coming out. What about Saunders? Saunders is good. So Saunders or anything from Elsevier, the people that wrote the HESI, use the book that comes with that. All right. Use the book that comes with that. Listen, your whole goal right now is to get out of nursing school. And the whole thing right now is to get out of nursing school, use the material that is given to you for the test by the people that wrote it. That's the best way for you to do it. Saunders is good. Saunders is good for whatever is given to you. It says, Kevin, it's been 5 years from India. I'm thinking to do nursing. How do I start? Is it Kamal? Kamal? I don't know exactly where you are in your nursing journey. And I don't know where you live. I don't know if you live like here in the US or if you live in Canada. But the biggest thing, first thing I would recommend is you need to find out what school you want to go to. Oh no, Tay, what's up? What's up, Tay? But Kamal, I would recommend looking at the school that you want to go to. Look at their prerequisites. Oh my God, I haven't been on your live in months. I know. What's up? What's up with that? Go look at the prerequisite for that school. And then you start doing those prerequisite classes. That's what you should do. That's where you should start. Oh, how to have a nice evening. You too, Geraldine. I've been so busy. I'm finally on my last semester. I know that's right. You're in the U.S. Okay, so that's what I would tell you, Kamal, is look for those schools, do the prerequisites, apply for your school, get in. Now, if you're already in nursing school, I would tell you the same exact thing that I told other people is to understand that nursing school is a game. Get into small groups of people and start to split things up evenly, and then you learn off of one another. Oh, no, not yet. Okay, so yeah, so the prerequisites is where you need to start then. You need to figure out what school you want to go to. So if you live in California, which is probably going to be a massive amount of just craziness to get into that school, it says it's good to start with LV. Yeah, you can. So you can start with an LVN. All right. It all truly depends on how much money you have. So you could start with LPN or LVN, right? You're telling me LVN, so you must be like in Florida, North Carolina, Texas, or Cali, somewhere around there. You can start with LVN, get your LVN, get your license, go work at a hospital, let that hospital pay for you to get your RN. There's more than one way. California, I figure, and let that hospital pay for your license, or pay for you to go get an RN. Is it true when they say nursing school is the most difficult part of the whole journey? It is. Nursing school is the most difficult part of your nursing journey at the beginning. No, that's right. Nursing school is the most difficult part. The second most difficult part is when you start working. The second most difficult part, you're welcome, Kamal. The second most part is when you start working. The NCLEX like when I passed the NCLEX, it was short lived. I was like, all right, cool. What now? And then when you start working, you're just like, wow. It's like, wow. It'll end, but it's more along the lines of it's continuous learning. That's what it is. It's continuous learning. And your first 9 months to a year and working on the floor or wherever you decide to go, you got to get adjusted. You're always a student of the game. Facts, you are 100%. But it gets easier as time goes on. But the crazy thing about nursing is that nursing is, number one, it's growing. Number two, you can always go in one place. You can always go to one place and then go to another. It says thoughts on starting off in the ER versus med-surg. ER can be very fast paced. Med-surg, depending on which one you go to, can be very fast paced. But med-surg is not as fast for the most part. I don't need people to come for me because they will. But med-surg, it allows for you to gain your time management. But you also have to realize that med-surg is a specialty. It is a specialty. People don't want to go there because they're like, med-surg. That was me. But med-surg is a specialty, and people work there to do their thing. You know what I'm saying? But it's a good place for you to learn how to be a nurse's nurse. You know what I'm saying? You learn how to do everything there. The only thing I can really recommend, or the thing you don't do drips, certain med-surges, and then it depends on the acuity of the patient. But you learn a lot. You do learn a lot there. You do learn a lot. I wish I went to Concord for my LPN school. So the biggest thing is to make sure that these places are accredited. All right. If they're not accredited, regionally accredited, as well as I think it's ACEN and CCRE, like those accreditations, like you need to make sure that they are accredited. They don't need to be under nobody's investigation by the Board of Nursing. They don't need to be waiting for accreditation. They don't need to be nothing like that, because they could be waiting for accreditation. You could be all the way through that program and they lose their accreditation, and now you're up shit's creek without a paddle. You know what I mean? All that time wasted. It could be wild. It could be wild. All right. So shout out to my Palm Beach graduate. Stop it. It says ACC was not accredited. I was just forced to continue. And that's what I'm trying to tell y'all. You have to do your research. Kamal says, let's start together. Hey, you're here. You're doing these lives. This is what we do. You know what I'm saying? Or if you want to check out whatever else I got going on, a link in my bio, you can check out all that too. So, but all right. I know, who is that? Is it Sherlina? You just shared the live and I'm about to get off, right? So, all right, ladies and gentlemen, hopefully I answered a bunch of you guys' questions today, because if I would have left, I would have had to start all over. Yep, that's exactly what happens. But some of those places, nah, I'm not going to say that. I would just say be aware. Be aware of the accreditation aspect, because last thing you want is for something to come and bite you. Make sure, hey, by the way, make sure you have all of your transcripts, all the paperwork that you got from that school. Period. Make sure you have it. All right. But shout out to all 20 of y'all. We did NCLEX questions. I'm about to go ahead and get off of here, because I guess I can go be a parent, right? But make sure you guys take care of yourself. All right, mentally, physically, spiritually. All right, you only got one you. You only got one you. And if you can't do what you got to do for you, you are no good to nobody else. All right. Make sure you guys check out what I got going on. Hey, check out my book. It's coming out June 5th. I got an ebook that helps specifically for NCLEX. I got an NCLEX course. If you need help, one-on-one coaching, that's offered to you. I do that as well. You check that out. That link is also in my bio. Kevin, I'm new here. Can you please explain what is credit means here? So accreditation means that they have gone through the approving body process to show that they are not allowed, but that they are who they say they are. That's what it is. It's kind of like where somebody scams you and they're just like, hey, I'm an investment banker and I can help you invest in all these things, but they have nothing to show for it. They have no resume to back that up. So with accreditation, it shows that they are who they say they are, that they're legit, and they're doing exactly what they say that they're doing, which is teaching students how to become nurses. Okay. You're welcome. No problem. But anyways, ladies and gentlemen, like I said, take care of yourself. Do something nice for somebody. It takes nothing. It costs you nothing to be kind to somebody else. Man, my lips are ashy. Anyways, but yeah, make sure you guys check all that. Make sure you guys go follow me on Instagram. Check me out on YouTube, all that stuff. Hey, interact with my videos. Okay. So, but yeah, I appreciate everybody. I appreciate everybody always coming by and participating. And yeah, and I'll see you guys hopefully on Wednesday. I got something coming up for y'all, so y'all stay tuned. Bye.